across our area. Syphilis skyrocketing in Houston. Good evening, I'm Keith Garvin.
Thank you for joining us. I'm Daniela Guzman. Well, the Houston Health Department is calling the sharp rise in cases of the sexually transmitted disease an outbreak. KPRC2's Andy Sirota live in Sunnyside, where a community meeting was held today about this. Andy?
Danny, Keith, a number of medical directors from some of the community-based health clinics attended that meeting here today at the Sunnyside Health and Multi-Service Center, along with members of the Harris County and Fort Bend County Health Departments. Of all the cases Houston health officials are seeing, it's predominantly women of color who are most impacted. Nationally, there's been an uptick in syphilis cases, and health officials here say in many ways Houston is no different when it comes to what's happening in many major urban areas across the country right now.
As a large urban jurisdiction, we've got to be really aggressive in our response when we see these kinds of cases, because we have millions of people who may be at risk.
Since 2016, syphilis cases in women have increased by 128%. New infections rose from 1,845 in 2019 to nearly 3,000 in 2022. Cases involving women who passed the infection onto their baby during pregnancy soaring from 16 cases in 2016 to 151 in 2021.
Ouch. Ouch. This is crazy, man. It's insane what's going on here. I mean, syphilis is not a game, man. These STDs are not a game. All right, let's get to the bottom of this right now. All right. Houston health officials are warning residents of a syphilis outbreak that is responsible for 128% increase in cases among women. The Houston Health Department said it has also led to ninefold rise in congenital syphilis in Houston and Harris County. Statistics indicated that new infections rose by 57% from 1,845 in 2019 to 2,905 in 2022. The number of cases among women totaled 674 last year, which is up from 295 in 2019. Congenital syphilis rose from 16 cases in 2016 to 151 cases in 2021, the latest year for which statistics are available. The department said Thursday that it would launch a rapid outreach response to address the issue, including increasing screening opportunities, targeting hotspots, and mobilizing community partners to curb new infections. It is crucial for pregnant women to seek prenatal care and syphilis testing to protect themselves from an infection that could result in the death of their babies. Marlene McNeese Ward, Deputy Assistant Director on the Department's Bureau of HIV, STI, and Viral Hepatitis Prevention, said in a statement, a pregnant woman needs to be tested for syphilis 3 times during her pregnancy. The department is waiving all clinical fees for sexually transmitted infections at its health centers and expanding the use of its HIV STD mobile clinic. It also is working with medical providers and collaborating with community-based partners to increase awareness of the outbreak and enhance testing and treatment. Testing is recommended 3 times at a woman's first prenatal visit, during the 3rd trimester, and at delivery. Untreated syphilis during pregnancy can result in stillbirth or a baby's death soon after birth. Notably, those with syphilis are at increased risk of HIV infection due to the painless sore that develops at the site of sexual contact during the disease first stage. While syphilis is easily treatable with antibiotics, without treatment, the infection progresses to secondary stage, where one or more areas of the skin break into a rash. Nevertheless, in most cases, syphilis goes undetected because the signs and symptoms are misinterpreted and unnoticed. If untreated, the bacterium that causes syphilis remains in the body and begins to damage the internal organs. The department recommends syphilis testing for pregnant women at their initial prenatal visit, 3rd trimester, and delivery. Those who have had unprotected sex, people with multiple sex partners, men with anonymous sex partners, and people recently diagnosed with any other sexually transmitted disease. Wow. This is something, man. I don't know what's going on, but it's time to bring back celibacy, because that's the only way to protect yourself from lying partners, and deceitful people among both genders. Let me know what you think in the comments. What are your thoughts about this? What do you think could be the possible reason why there's such an outbreak? All right. You know what to do. Anything you want to know about this channel is in the description box. Once again, like, share, comment, and subscribe.